Hi everyone, Dr. Suneel Dhand, internal medicine physician. Hope is a very important thing to most people. In fact, hope is part of the human condition. We all need hope, especially during bad times. And I've talked a lot about our COVID pandemic mass response and mistakes we've made in public messaging. But this is another huge area. How many TV doctors have you seen come up on our screens, whether it's cable news or social media, and present a message with even an inkling of optimism and hope? Not very many. It's all been doom and gloom, pessimism, and frequently a sense of panic. And where this becomes a problem, if I use myself as an example, as a doctor, I consider it my job, as well as treating patients medically, to also instill a sense of encouragement in them. When I'm rounding in the hospital, if they have a condition where I know the chances are that they'll get through this, it's not a dire situation, I'll go in the room and tell them. I will say something like, yes, you're in a tough spot now, you're suffering, we know that, but we've got lots of good treatments, you'll get through this, you'll be home in no time, there's light at the end of the tunnel, everything will be okay. And I feel totally appropriate doing that when I know the chances are that they will get through the illness. I'm not going to walk in the room and make them feel worse. And contrast this with our TV physician experts, other science leaders who have got up on their podiums, they've had millions of eyes and ears on them, and it's all been a sense of doom and gloom, frequently, as I said, with panic in there as well. They put forward messages such as, oh, the cases are really high, we need to abide by this strict measure, we need to follow these rules, and if you're all good and you do what we say, then maybe after a few months we'll be able to relax this rule. If you all follow this protocol, then perhaps after several months we may be able to do that. I mean, it's completely ridiculous. It's the wrong type of messaging. That would be like me as a doctor walking into a patient's room who's, say, broken their leg. I know the chances are they'll recover, and I tell them that, yeah, okay, your leg is all strapped up now. Maybe if you do this, follow what we say, after a few months you may be able to take these steps, and then perhaps we could regroup after several months and maybe this could happen. I mean, it's completely ridiculous. No doctor would ever give that sort of pessimistic message to their patient. What these TV doctors should have done is be both serious and hopeful. Yes, that's very possible. You can tell people the truth. Yes, cases are high, but we'll get through this. We'll follow these measures. There's light at the end of the tunnel. We know that historically pandemics don't last forever. The curves do come down, and we live in a modern age with great treatments, and we're going to get through this. The goal is not for lockdowns and social distancing and masks to last forever. There is some hope out there, and I wish that that had happened. Imagine in centuries gone past if we had presented public messages during, say, times of crisis like wars, which were full of pessimism, defeatism, and unfortunately also shaming people, which has happened here as well during COVID. We wouldn't have won too many wars that way. So much of the public response to any time of crisis is in the public messaging. What I would tell any doctor out there or anyone else who's medically trained to always keep in mind is that whether we're dealing with people on a mass scale, such as a pandemic response, or one-on-one in health, it's not all about the medicine and the internal biology. People are people, and people need hope and optimism. Never forget that.